what is missed or what is not looked at is one, it is not a participative journey to the end consumer. So there is a diagnostic report which he can't comprehend, there is a prescription which he barely can read, and there is no wellness or a preventive aspect to the whole journey. So the information piece is completely missed out. Healthcare in India is uh, uh, is a financial problem as well, and that's where uh, you say that insurance has to come and make a play, but we have a very underpenetrated scenario today. Now let's just take a step back and think that from our perspective what we're trying to build. So healthcare has three large components as we would have looked at, understood, and seen in the past. So one is your consultation, which is your doctor interaction at hospital, at clinic, or in a virtual scenario. The second is uh, pharmacy. So if you went to a doctor, a prescription is generated. Either you'll be asked for a diagnostic test or a prescription with certain medicines to it. So these are the three pillars which constitute the healthcare definition for a consumer. What is missed or what is not looked at is one, it is not a participative journey to the end consumer. So there is a diagnostic report which he can't comprehend, there is a prescription which he barely can read, and there is no wellness or a preventive aspect to the whole journey. So the information piece is completely missed out. So what we did, or what we started, is first to make healthcare understandable to the end user. So that was the first piece that we solved. We hit a chord with the user. There was a need gap that was existing, and we built on that. The second was accessible. So how do you make healthcare services, information, benefits accessible to the larger population? And that's where you see the transactional services, and where can you bring affordable quality cares to the end consumer. So that was the thought process which we built, and with the consumer centric approach, each of these elements tied together, and we offered an integrated solution to the end consumer. And that was a mission on which we defined and agreed on day one. Now from a consumer perspective, if you look, he will not have a diagnostic XYZ's company's app, and then another company's app, and then another company for teleconsult, for another for health record, then another for pharmacy, then another for something else. So from a consumer perspective, and if you look at the trends, for the last 5 years or so, a consumer used to have 35, 40 odd apps, and out of those, six or four used to be the apps he would constantly use. That number has migrated to 60 and 70 apps on a typical phone, and 8 to 10 apps he would generally use. So you will have a shopping vertical, you will have an information vertical, you will have a travel vertical, and similarly you will have a health vertical. So that's how the consumer and the ecosystem is also maturing. So it's a natural progression that you'll see, that when we started, we had this vision, and we are implementing from the consumer, and the ecosystem is now also reacting in the same fashion. So it's not something that a value add that we started. It was a part of the plan, a part of the vision that we want to service to the consumer from a healthcare perspective, that any step, any intervention, any requirement a consumer might have in his entire healthcare journey, how do we make him more participative, more empowered to make better health choices? So that has been the vision, and that largely now ecosystem has also started to shape up. Hospital is a typical example of it, and how do you unlock, how do you make hospital borderless is what we're trying to aim, and that's what technology is all about. Home healthcare is another element to it. So today, that has not been actively promoted through the platform, but that's the next extension that you will get to. So, and as you mentioned, a larger part is recovery. So there is discovery, which is right information on the surgery. There is the surgery part as well, which is the hospitalization, or at clinic, or at any place where it can be possible. And then there is recovery, and technology can play a role in all the three. So always look at as an enabler for each of the steps of the consumer journey, and that's what has been true, and it has not been envisioned, at least at the consumer level or the ecosystem level, which we have today showcased and proved.